Morning, and welcome to your weekly Cup of Joe. My name is Joe King. I'm the owner of Physical Therapy Advantage here in North Aurora. And this week we're going to talk about the top 3 exercises for low back pain. We did the top 3 stretches for low back pain last week. We're going to talk about the top 3 exercises. Now, these 3 exercises are very simple. They're very basic ones. So hopefully, if you're having some severe low back pain, these will definitely help. They're not too advanced. But they may seem too simple if you just have general low back pain. So just a little FYI there. To start with, you'll do these, you can do them in bed. As long as your bed's not too soft, we prefer you to be on the floor, but understand with low back pain, you may not be able to get down on the floor. You get down laying on your back with your knees bent. Typically that always feels a little bit better for people. Sometimes they have to elevate their feet up, and you can do it with your feet elevated onto something if you needed to, but with your knees bent. And what we're going to do is we're going to spread the feet apart as far as you can, as far as comfortable feels. And what we're going to do is we're going to drop one leg in at a time. So I'm going to drop my left leg in as far as I can, and then we come back and drop my right leg in as far as I can. Back and forth. It's an active stretch or a motion of hip internal rotation. You may have to, like I have to move my left leg out just a little bit, allow my right leg to go down as far as you can. So your both legs move a little bit. Sometimes you may not move that far, depending on how painful or how stiff things are. Back and forth. Typically about 20 repetitions total, 10 on each, or 10 or 15 repetitions on each. And you can do that 1, 2, 3 sets. If it feels real good, you can do more. The next exercise is very similar. You bring your feet back to a much more comfortable neutral position, so your feet are lined up with your knees and your hips, same kind of width. And now you're going to move both legs at the same time. We're just going to go back and forth, always keeping the knees apart. You're not letting your knees touch as you're going side to side. There's always some space in between, and you're only going a very short distance. We're trying to initiate some oscillatory movement and get some low back muscles, some rotaries muscles to start firing. And the oscillation would also hopefully help basically calm some muscle spasms down at the same time. So back and forth. Right, left 1, right, left 2. And we'll do that 20 repetitions as well, and maybe 2 sets, maybe 3 sets, depending. Most people feel like this feels really good for calms things down. The next exercise we're going to do is pelvic tilts. So basically we're going to put an arch in our back, and then we're going to flatten our back. We're going to do all the motion at our hips. So I'm going to flatten my back out, and then I'm going to arch. I'm going to gently flatten my back out, and I'm going to arch. You want to stay within the pain-free range. You do not want to create pain with anything that we do. The no pain, no gain theory does not work. If you're creating pain, you're creating inflammation. If you're creating inflammation, things are going to get swollen and sore and cause you to take steps backwards. So flatten the back, gentle arch. And you just go with the short distance that you have. If you can go more, great. You can go more. Same thing, 15 to 20 repetitions, maybe 2 sets, maybe 3 sets. All right. The last thing we're going to talk about, I'm going to do this again here, is that we want to teach you how to, it's a little bonus section here, is so not just the top 3 exercises, there's a little bonus. Engaging your abdominals as you transition, as you move from one position to another. You want to think about tightening up your stomach muscles, your lower stomach muscles. Engaging those abs as you move. So if you're sitting on the edge of your bed and you need to lie down, that doesn't really normally feel good to you. Engage your abs, go down on your side, pick your legs up, go down, keep your abs tight then, and then you can roll to your back. Or if you have to scoot from side to side, engage your abs, pick your butt up just a little bit and move. Take your elbows in, engage your abs and move. Or if I have to roll to a side and everything, I'm going to engage my abs and I'm going to roll. I'm going to engage my abs. I'm going to use my upper arm. I'm going to use my lower arm. Everything's going to press in. I'm going to engage my abs. And I'm going to get myself up. If I have to get up from sitting, from a chair, from the bed, wherever, I'm going to engage my abs and I'm going to come up. So the more that you can do that as well, will hopefully help decrease the daily irritating factors and help calm things down a little bit more. And of course, the last thing, another bonus, don't really call it a bonus, it's pretty much out there, is that you can use ice or heat. Typically, ice seems to work better to calm things down with inflammation, but some people don't really, feel good with ice, so they like to use the heat better. So whatever gets you out of that pain cycle at that point in time, heat or ice, 15-20 minutes maximum, 1 time an hour, 2 times an hour, whatever it means. Don't go for a long distance or a long time. 15 to 20 minute sessions, once an hour, twice an hour, you can use as much as you want. And that should hopefully help calm some things down too. So hope those things help you out. The top 3 exercises for low back pain. We did the top 3 stretches last week. If you have any questions about these stretches or exercises, please don't hesitate to call 630-892-8003. That's 630-892-8003. We look forward to seeing you next week for your weekly cup of Joe. Bye.